On-the-scene video coverage of ESC 2012 is supported by Pradaxa.
Welcome back. Deepak and I are here at the European Society of Cardiology meeting in Munich, and one of the studies that was really of great interest to me was the DeFACTO trial. And CT angiography has held the promise of being a really effective way to screen for coronary artery disease, but we know oftentimes that it overestimates the severity of lesions, and so if there was a way to assess the physiological significance of lesions, what a boon that would be to CT angiography. And that was the hope in developing this computerized algorithm based on hydrodynamics to essentially do a non-invasive fractional flow reserve. And in this multi-center DeFACTO trial, they tested the ability of this non-invasive FFR derived from CTA against just CTA alone, using FFR from catheterization as the gold standard. And the answer was a bit mixed. The primary endpoint as to the statistically significant superiority of CT with FFR over CT alone didn't quite make the grade. However, it was clear that adding the non-invasive FFR did make it a bit more accurate test and gave it a negative predictive value. They also made a point in these patients with intermediate severity lesions that it was very helpful. So not making the primary endpoint, but perhaps with enough there to go on to more studies.
Yeah, I think the concept is sound, coupling anatomy with physiology. That's what we really need to do in assessing patients for their risk of subsequent ischemic events. So even if this didn't hit its primary endpoint, I think the technology or related technologies are promising.
Yeah, and I think as the quality of CTAs increases, and perhaps with some refinements of the algorithm, this could really be very important in one study to get physiology and anatomy. That would really be enormously valuable.
Absolutely. Of course, there's the gold standard coronary angiography and invasive FFR, and we'll hear more about that with the FAME-2 trial that's coming on later in the meeting.
Yeah, I'm looking forward to that. Now, the TRILOGY trial was pretty interesting, although in a kind of a unusual group of patients with ACS being treated without intervention.
Right. So as you know, I was on the steering committee of that study and have an affinity for those data. I think it was an important trial. And even though the primary endpoint was negative, I think it will lend a lot of insight into the medical management of acute coronary syndrome. So most ACS trials are focused on revascularization, appropriately so. This trial focused on patients who were initially medically managed for their acute coronary syndrome, and indeed most of them continued to be medically managed throughout the trial duration. Patients were randomized to clopidogrel or prasugrel, and for the overall trial, it was a negative result. No benefit of prasugrel over clopidogrel on the primary endpoint, though recurrent ischemic events were significantly lower with prasugrel versus clopidogrel in a pre-specified analysis. So some signals there, but the overall trial was negative.
It was interesting to me, however, that bleeding was not any greater with prasugrel, and of course that's been an issue in past trials.
Well, an interesting aspect of this study is that it tailored the dose of prasugrel by phenotype, so not tailoring by platelet function or genetics, but just by if the patient were less than 60 kilograms or more than 75 years of age, they got a 5 milligram maintenance dose instead of a 10 milligram maintenance dose of prasugrel. Maybe that's why there was less bleeding. So I do think that concept of dosage modification based on phenotype, even just beyond prasugrel, has merit.
Yeah, very interesting. Now, we also had a phase 2 trial, a trial of a new agent, doesn't even have a name, that's a combination angiotensin receptor blocker plus a neprilysin inhibitor to increase BNP, and looking at that as an agent, again, that could be of benefit in diastolic heart failure.
Right. So Once more, I think this points to the fact that we're all, as clinicians, looking for effective treatments for heart failure with preserved ejection fraction or diastolic heart failure. And this agent seemed promising. This was a phase 2 study, but a phase 3 trial is ongoing.
Yeah, it'll be interesting. The never-ending search for an effective therapy for diastolic heart failure. Thanks very much for being with us.
Thank you.